Hi, good morning, rather good afternoon, everybody. Welcome to another session of uh, live from MGM. And this time I'm going to address a lot of doubts and queries which is coming through a lot of people who are asking us what next. And well, what next is a very, what to say, it's a spectrum of what next we have. The most important thing, let us start with what is happening now. What's happening now is that, yes, the COVID situation is quite under control. I mean, we have done an amazing job of handling the cases, handling the home quarantine, handling the sick cases, whatever the best way we knew, because like I kept telling it, pretty much most of my colleagues who say the same thing, that it just hit the whole globe totally tangent. And we didn't know where we were going. So many information about what the disease is, what medications, how to go about it. So many, I mean, it was like literally, I mean, women will identify with what I'm saying. It was like literally sari shopping in Sarvana Bhavan, or jewelry shopping. It's like chaos. But through the chaos, we have waded and successfully come down from almost 3,000 plus cases in May and June to almost 300 and less than 300 cases per day. And most of them are asymptomatic. Some of them are mild symptoms. Yes, we still do have those sporadic cases who are really very sick. Across the city, across the state, across the country, across the globe, we all know people who have lost their near and dear ones. The it is statistics for healthcare workers, for the government, but for us, they are all people. They are somebody we knew, closely associated. They were there with us the previous day, and now they are not there with us, and that is, I think, taking a big toll on the social construct and the psychological issues which are coming up with the thing. It has also got a lot of us unaware about how the logistics of a acute pandemic or acute febrile a fever episode or something which we always used to take very lightly. I've had many people who used to just panic and come to the hospital, and we tell them that it's okay, go home, you're fine, you don't need big treatment, you just, it's a viral disease. And so if it is just a viral disease, why are we making such a much ado about nothing sort of a thing? But because there are certain high risk patients, high risk people who got affected much worse. Now with the advent of vaccines, with the advent of the so-called new strain in the UK, then the closing of other country borders, the European borders, we are again worried that is the second wave going to hit India? So I have one answer to this, that COVID is less, it's diminishing, but it's not over. It is not going to be, it's not going to go away. COVID is here to stay, and we need to continue the lifestyle which we have adapted in the last 6 months absolutely to the T. That means we have to continue wearing mask, we have to continue sanitizing our house and our hands, but we don't have to be very fanatic about it. We don't wash our vegetables with Dettol. We don't need to wash all our surfaces, laptops and phones with. No, we don't have to do all those things. You just need to ensure that we need to take care of those portal of entry. Remember, COVID infection, COVID pneumonia, COVID flu is like a pen drive. If the pen drive gets a slot into the computer, only then it will work. Otherwise, it will not work. So let us not panic again. Even if the second wave hit, I think we are prepared for it. Our healthcare infrastructure has definitely improved, and we are going to be able to handle it heads on. Hopefully, let us pray for the fact that it is not going to be as devastating as it was the first wave. Why are some of the countries' second wave very bad and they had to go for a lockdown now? Because I personally feel that they did not do the lockdown the first time. They were very easy because they come from these are the countries which are in very cold climates. So for them, that summer is very, very important. Now the lockdown has been implemented because people the infection will spread. So the red herring words, the important words are cluster, confined spaces, public places. So in that public places, even for us today, malls, theaters, recirculated AC airs, AC circulation. So these are the things which will put us at risk. But we have reached a stage where we cannot have any more stopping of the routine life. We need to restart, go back to some form of normalcy, some semblance of normalcy has to come back. So, couple of things which we really need to go back to is yes, we need to go back to work. Those who have the those who have the what to say they have the advantage of working from home, please take it. But remember something, everything has its pros and cons. Those who are working from home need to ensure that they are having they're not isolating themselves. They are taking care of their health by eating on time, maintaining a good sleep pattern, taking out time to work out, because sitting is still the bad thing. Sitting is still going to make you put on weight. The lethargy sets in, and that has affected a lot of people very badly. The sugars have gone up, the BP has gone up, depression has set in. People are not able to sleep well because there's no physical activity, there is no routine, there is no reason for them to go on because they're all confined to the house. So no longer there is any reason to confine. You can go to the market, you can go to, but remember, mask. Which mask? I mean, we've had collection of people, 10 people or 15 people getting together in a small, probably a 10 by 10 or a 20 by 20 room, which is supposed to be big enough. But the problem here is that how much is that cloth mask going to help us? So how does this mask help us? Let us be. So this virus comes and hits you on the face, and the mask is supposed to prevent the entry of the virus into your mouth or through your nose and all. If it is a good surgical mask, a 3-ply mask or an N95 mask, then we are confident that it works. The cloth the cloth mask is something which you wear it, go home, throw it to one side, and then again you just pick it up when you're going to go out again. You hang it on your in your pocket, and also it doesn't work like that. So you need to ensure that you're wearing this mask. You go back home, put it to wash. Next time you go out again, you need to take another new cloth mask. But if you're using, say, for example, a surgical mask, you can probably use it throughout the day in public places. But if you're going to a hospital, you need to definitely use that mask. And again, that mask needs to be discarded. Or if you're going to a mall or you're going to a theater, you're going to a pub, so you need to wear that mask very, very religiously. But when you come home, you need to discard it. You cannot reuse it. Or the other way is like lot of these manufacturers give us these instructions that you need to hang it in the sun for 72 hours and then after that you can use it. But Chennai is a very humid place. Now it is a little dry. We don't have much sun. You can definitely use that. But remember, the protection which that particular mask is going to give is probably 50% or less. The N95 mask which we wear in the hospital is something which affords us a little bigger, much stronger protection, and we send it for what we call as an ethanol sterilization process and all, and we will do use it in every 3 days, but it is sterilized for us, and we follow a very strict protocol about it. If I'm not confident that it has been sterilized right, I discard it. Now, how do we get back to the topic of today's discussion is how do we get back to our normalcy? What has happened to us in the last 6 months is that some sort of lethargy has set in our mind, in our body, and we are finding excuses not to take care of our health. If we don't take care of our health, Indians, we are very, 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 very prone to diabetes, heart attack, high blood pressure. So, no longer the time has come where we need to just stop making excuses and just start doing things for us. So, get up in the morning, set a routine, eat a healthy breakfast, plan your lunch and your dinner, take out an hour's time to go for a good walk, go for a good, um, a some form of physical activity, whether it is badminton, whether it is anything. But one thing which I realized is don't start off everything suddenly. You'll end up with having a lot of aches and pains, and that's it. Don't get into any big gym membership where you're not going to be able to sustain it. So sustainability, you need to ensure that anything which you're going to do is going to be a game changer. It's going to be a lifetime commitment, and that is the commitment which we owe to ourselves. Yeah. So I'm open for questions. If there are any questions, please let it come. Till the time, I'll keep talking about what I'm supposed to be saying anyway. Right. Now, the next thing is, what about all these varied treatments which have come? We have had a good, treatment protocol. We sat together, my team, my critical care consultant helped. I mean, amazing. Our infectious disease consultant. I mean, really, really thankful to all of them that we have at MGM, we have kind of come through and been able to have a very transparent treatment protocols and been able to help a lot of people. So we still don't know whether, yes, that is the right, wrong. The studies, some of the studies say this is not right, this is not right. So, but a lot of these medications we do not use. Oral medications don't work. We still have antiviral, couple of antivirals are still in the offing, very, very promising. So maybe they will come. High dose steroids is something which we have used, oxygen therapy, some amount of convalescent plasma, very, very strict guidelines are there for that. So we have been using that. Now, once a patient picks up COVID and they go back, we've had some come back with antibody levels. And also, what does this antibody mean? This antibody is a temporary indication that yes, your body has responded to a virus coming into your body, but that's about it. How much protection this is going to give you for reinfection or for a new infection, we still don't know. We have had a couple of patients who turned positive around 6 months back. Again, they came back with a second round of disease. So 6 months is a huge time. But I personally felt that those patients didn't have any symptom the first round. So it was just a coincidental symptomatic. So just fine. So you will see a lot of people, first time, then the second time they became very sick. And so maybe the reinfection for them was bad. So we really don't know. Now coming to the third very important thing, that is the vaccines. Most vaccines have been generated in the last 25 years. Amazing vaccines. We give it to all our children. We've been able to eradicate polio. We've been able to bring chickenpox under control. Smallpox has been eradicated. So vaccines help. Let us not doubt whether the vaccines help or not. The fact that these vaccines have come faster does not mean that they are not effective. Does not mean, but that only means that the science and technology has come up to such a great level that these dedicated scientists, these dedicated pharmaceuticals have been able to come out with vaccine. These vaccines have gone through lot of stringent measures to come out, and we know that they are safe. Most of these vaccines are safe. Safety has been established. Efficacy, we will know how much it is as the time goes. But even if we take the vaccine, some vaccines are single dose, some vaccines are multiple dose, some you have to repeat after 3 months. A lot of protocols are there, but one thing which we cannot forget is wearing the mask. Just because you've got vaccine or you've developed a COVID infection and your antibody is positive does not mean that you are ready for to face the world, or you've developed one karana kavacham or and something like that. That no, it does not really uh, work like that. We still don't know how much. So we will know by probably in another 6 months' time how good these vaccines are. So who gets to take the vaccine? The vaccine is for everybody, immaterial of whether you have developed COVID infection or not. You have not, or no, you have to take the vaccine. It's your choice. But I think we should take the vaccines, and that will give us a little confidence to move out in the society and not make any more excuse about stepping out of the house to work out, to go for exercises, and to start leading a healthy life. So very important is to have a baseline check to know, okay, I have put on 5 kg weight, I put on 10 kg weight, I know I'm already on the overweight side, I was pre-diabetic, I had a little bit of cholesterol, I have a thyroid problem. This pandemic time we have hesitated to let the lab people come home and check the blood. So I need to get it validated whether I how is my baseline before I start a workout. So just go ahead and get a good health check done and see where you stand. Probably everything is still normal. Only thing you need to do is start working out, eating right, and lose your weight. So that is where your future lies. The future lies in three things. One, to ensure that you are able to go back to a good normalcy, a normal routine with caution. The caution being wear mask, use sanitizer. Wear mask, use sanitizer. Second thing, take care of your health. And health and social well-being means you take care of your physical health, you take care of your mental health, you take care of your uh, social well-being, you take care of your logistics. So if you have still not invested in a good health insurance, please invest in a good health insurance. Talk it out with the health agent about whether it is going to get covered for all these infections. There is H1N1, there is dengue, there is COVID. So does it cover all these things? Don't short charge yourself when you're buying a good health insurance policy. Any blood test you are going to do, any lab work you are going to do, please ensure that you are going to get it validated by a good physician or your family physician or your family doctor. Lot of standalone labs are promoting lot of health, the blood checks. Like there are like 100 tests in 1,500 rupees or 1,800 rupees. I don't even know what half of those values are. Do they really extrapolate to a health situation? I mean, if my magnesium is normal, or if my strontium is normal, if my cadmium is normal, how does it matter? But my sugars are not normal. What am I going to do about that? My uric acid is not normal. My cholesterol is high. So what am I going to do about that? So that is where, just doing the blood test, oh my God, my homocysteine level is very high. I'm panicking. And that homocysteine is something which we have never heard about. You go to a cardiologist, yes, but your homocysteine is high, but your LDL is also high, your bad cholesterol is also high. So you need to do something about that. You need to you need to go back to your doctor, ask what does these tests mean, what does these lab values mean, what do we do about this. Am I on the right track? Do I need to worry about it? Remember something, I very strongly believe that I don't read reports. Does this LDL high in a 30-year-old, otherwise fit person whose ECG is normal, whose treadmill is normal, going to ask him to do an angio just because his LDL is high? No, I'm not going to. I'm going to give him a good chance with diet and physical activity, and then we will decide whether he really needs. Having said that, if the person has a very strong family history of early cardiac death, his father had a heart attack, or his grandfather died, his uncle had a heart attack, they had an early bypass, not something which I would overlook then, definitely. So what we do is that, what I'm trying to tell you is that we do not um, only see the report and treat. We need to make a clinical correlation. We need to ensure that uh, the person does not have a medical problem. We do ultrasound, and ultrasound shows fatty liver. The fatty liver is the existing reality of Indians. I feel Indians, why do we panic about fatty liver? Fatty liver does not mean cirrhosis. Fatty liver means that everything extra in our body is getting accumulated in the liver. And what is this extra? This extra is this extra fat, extra sugar. So that means we are pre-diabetic. We are have bad cholesterol. We have high cholesterol. We need to ensure that we are taking care of that. So go back to your doctor. Go back to a good health. Go back to a good routine. The third or fourth thing which I've seen in a lot of women during the COVID, even in men, is this low hemoglobin. Anemia is never ever normal. My hemoglobin has always been 10 grams. No, it's not acceptable. Male above 13.5, females above 12.5 is our cutoff. And this cutoff is there for a certain reason. That is because as we grow older, so the amount of duration of the amount of time we have had anemia, low hemoglobin means that much less oxygen, that much less oxygen to the brain, that much less oxygen to the kidneys, to the heart, and it is going to create an effect somewhere. When patients are chronically anemic, they don't even realize where it started. They don't even remember how sick they have been. They get used to it because the hemoglobin is on the lower side. You're sitting at home, you're not doing any workout, but when you start working out, it starts with the breathlessness. Your blood, which can be easily correctable. Most of them don't even need medication. All you need is to improve your diet. So these are some very small, basic things which we keep talking, we keep telling, reiterating again and again, again and again. Yes, COVID came in, put a very big challenge to us about what type of life we are leading. I think we should have used this 9 months time, and where am I standing? I mean, this I've got a fantastic opportunity to reassess where I am. What am I doing? Am I in the right place at my work, at my personal life, in my emotional, in my health? And I got a chance to change this dynamic. And now I'm going to restart my um, a new life. We nature keeps giving us multiple opportunities. Chennai people know this. We've had tsunamis, we've had floods, we've had cyclones. Everything the nature is telling us that somewhere we are going wrong. We are leading a very superfluous, very highly toxic life. These challenges thrown by nature is giving us a time and opportunity to really think and like give us a guidance that I need to put my life back into uh, stream. So am I doing that? Am I taking it the right way? I think this is what I'm looking forward to, an amazing new year. Just hoping that 2021 comes with a brighter and a healthier lifestyle. Any questions? Yeah. So what are the going to be our resolution in for the new year? So we all make new year resolution. I'm going to start gym. I'm going to start eating healthy. I'm going to giving up sugar. I'm going to ensure that I'm taking my medications on time. I'm going to sleep on time. The important thing which we need to do is that is that every day is a new year. Every day is your birthday. Every day is a reason why you need to celebrate life. Life is so short. We have lost so many people in this pandemic. All of those would have been looking forward to an amazing life ahead. Uh, I mean, it is so sad to just think about those people. Would we want to be in their place? Would we? What will happen if I die? I lose it. My life is gone. Other people will move on. That's about it. But I should keep reminding myself every day morning when I wake up, Yes, today I'm going to go for a walk, wear my shoe, get on with it, go for a walk, come back, eat a healthy breakfast, check my sugars, check my blood pressure, ensure that I'm taking medicines on time, and we, not hesitate to take help where it is needed, whether it is for your diet, whether it is for your high blood pressure or sugar, whether it is for psychological help, please take help. Denial is only going to aggravate the mess you are in, or aggravate the problem you are in. It is not going to go away. Please take help. Small things can be handled much more easier, much more faster than when it becomes compounded. What we can spend 100 rupees on today, maybe we'll end up spending 10,000 rupees later on. So please ensure that you are taking the right decision. Only you can take that right decision for yourself. And Happy New Year, Merry Christmas, and Happy New Year. Looking forward to seeing you all in good health and prosperity in 2021. Thank you very much.